Now that we have talked about the expanded program on immunizations, history, goals, and coverage, let us move forward to the target diseases of this program. These are the infectious diseases that vaccines under the EPI aim to prevent among infants, children, and mothers. Understanding each disease, its transmission, and its prevention helps us appreciate the crucial role of immunization in saving lives and improving community health. Let us begin with tuberculosis, or popularly known as TB. This is one of the world's deadliest infectious diseases. The BCG vaccine, which stands for Bacillus calmette-guerin, is given at birth to provide early protection. It prevents severe forms of childhood TB, such as meningitis and miliary TB, which can be fatal if left untreated. The vaccine is given intradermally, usually on the right deltoid, requiring precision and proper technique. In a high TB burden country like the Philippines, where transmission is widespread, early vaccination is a national priority. Nurses must ensure newborns are immunized before discharge from the hospital or from the lying in or birthing homes, or the earliest postnatal visits. Poliomyelitis, or polio, is a viral infection that attacks the nervous system, causing acute flaccid paralysis. The vaccine can be given as OPV, or oral polio vaccine, or IPV, inactivated polio vaccine. Both of these types of polio vaccines interrupt the fecal oral transmission, which is common in areas with poor sanitation. The Philippines has maintained its polio free status since 2000, but vigilance continues through acute flaccid paralysis, or AFP surveillance, and supplemental immunization activities, or SIAs. As nurses, we educate families on completing the full OPV or IPV series to ensure lifelong protection and sustain our polio free certification. Diphtheria is caused by the bacteria Corynebacterium diphtheriae, which produces a toxin leading to throat infection, airway obstruction, and sometimes heart or nerve damage. This disease is controlled through the diphtheria toxoid vaccine, found in DPT or DT or TD formulations. Outbreaks occur when vaccination coverage declines, which is why sustaining a high uptake of at least 95% is essential. Nurses play a role in outbreak prevention through surveillance, community awareness, and ensuring that every child completes their DPT schedule. Pertussis or whooping cough is a bacterial respiratory infection characterized by severe, prolonged coughing fits. It is especially dangerous for infants, often leading to hospitalization or even death. The vaccine is included as part of DPT or diphtheria, pertussis, tetanus, or DTaP with a cellular pertussis components. It is administered at 6, 10, and 14 weeks as part of the routine immunization schedule. By completing these early doses, infants develop protection before their first exposure. Nurses must monitor adherence and educate parents to complete the 3-dose series without delay. Tetanus is caused by a neurotoxin from Clostridium tetani that leads to severe muscle spasms and rigidity. It has a neonatal form, often resulting from unsterile delivery practices such as cutting the umbilical cord with contaminated instruments. The DPT vaccine protects infants, while tetanus toxoid vaccination for pregnant women prevents neonatal tetanus by transferring antibodies to the baby. Nurses promote both clean delivery practices and maternal immunization, a powerful combination for eliminating neonatal tetanus in communities. Measles or rubella is one of the most contagious human diseases. It spreads through droplets and can lead to pneumonia, diarrhea, or encephalitis. The MR or measles rubella or MMR, measles, mumps, rubella vaccine is given at 9 months of age as the first dose. To prevent outbreaks, 95% coverage or higher must be maintained. Even small declines can trigger epidemic waves. Periodic supplemental immunization activities or SIAs help close immunity gaps. Nurses also conduct community monitoring to identify unvaccinated children and link them to the nearest health post. Hepatitis B is a viral infection transmitted through blood and body fluids. In newborns, transmission often occurs from mother to child during birth, a process called perinatal transmission. The birth dose must be given within 24 hours after delivery, followed by a full vaccine series. This protection early on prevents chronic infection, which can lead to liver cirrhosis and hepatocellular carcinoma later in life. Nurses in both hospital and community settings must ensure that every newborn receives this first dose on time. It is one of the most time critical interventions in EPI. Haemophilus influenzae type B or Hib is a bacterial infection that causes meningitis and severe pneumonia, particularly among children under 5. It is now included in the pentavalent vaccine, which includes also DPT, Hep B, and Hib, simplifying the immunization schedule. Since its introduction, the Philippines have seen a sharp decline in invasive Hib disease and hospitalizations due to pneumonia. Nurses should educate parents about combination vaccines like the pentavalent, explaining that a single shot can protect against multiple diseases safely and effectively. Finally, let us discuss pneumococcal and rotavirus diseases. The PCV or pneumococcal conjugate vaccine protects against Streptococcus pneumoniae, which causes pneumonia, sepsis, and meningitis. Meanwhile, the rotavirus vaccine is given orally and prevents severe diarrhea and dehydration, which is one of the leading causes of infant mortality worldwide. Both vaccines, the PCV and the rotavirus vaccine, significantly reduce hospital admissions under 5 years old and deaths in this age bracket. These are among the newer additions to the EPI, showing how the problem continues to evolve to address emerging public health threats. To summarize, The EPI target diseases, tuberculosis, polio, diphtheria, pertussis, tetanus, measles, hepatitis B, Hib, pneumococcal, and rotavirus infections represent a major threats to child survival and community health. Through effective immunization, the Philippines has drastically reduced morbidity and mortality from these illnesses. Always remember, every vaccine given is a promise of protection, not just for one child, but for the entire community.